Now we continue with the gathering points, the REN17 chest center Danzhong. The location of REN17 is on the anterior midline on the level of the fourth intercostal space. To locate, the quick method, especially in men, REN17 is on the sternum between the two nipples. Okay? For more detailed orientation on the intercostal region, first, locate the monobrous sternal synchondrosis, which can be felt on the sternum as a well-defined horizontal bony structure on the level of the costal cartilage of the second rib. The second intercostal space is below it. From there, count in an inferior direction to the fourth intercostal space to locate REN17 on this level on the midline of the sternum. Locate on the same level on the fourth intercostal space we have the kidney 23, stomach 17, PC1, spleen 18, GB 22, GB 23. 2 tune lateral to the midline on the nipple, 1 tune lateral to the nipple, 6 tune lateral to the midline on the axillary line, 1 tune anterior to GB 22. So we have that on the illustration on the picture. Okay, sa needling, depending on the indication, 0.5 to 1 tune transversely, subcutaneously in a superior or inferior direction or towards the nipple for mammillary disorders. Caution, intracardiac needling, pneumothorax. The sternum can be very thin in this area owing to embryonic ossification disorders. Moxibustion is recommended in order to tonify the chi, but caution with asthmatic patients. With regards to action and indication, this is to regulate and benefits the chi, unbinds the chest, descends the counterflow of the lung and stomach chi, benefits the breast. The special features: front move point of the pericardium, meeting point of the spleen, kidney, small intestine, triple burner channel. The wing meeting point of the chi, C of chi, important point for respiratory disorder. Okay, we have that here in the picture, in the illustration. REN17 is a very important point to tonify chi. It is both the gathering point for chi and a point of the C of chi. It tonifies the chi of the chest and the gathering chi, which is related to heart and lungs. Thus, this point is used to tonify the chi, but only in relation to lung chi, not so much spleen or kidney chi. If the deficiency of chi is due to weakness of the stomach or spleen, this point alone would not be enough to tonify chi, but other points would have to be used, such as stomach 36, REN12, and REN6. Besides tonifying chi, it also moves chi and eliminates stagnation of chi in the chest. It is therefore used in any condition of stagnation of chi in the chest, with such symptoms as feeling of constriction, tightness, oppression, or pain in the chest. REN17 dispels fullness of the chest, promotes the descending of lung chi, and helps breathing. It is therefore used for breathlessness from any origin, whether it is from the lung chi or heart chi deficiency or from obstruction of the chest by phlegm. Finally, it benefits the breast and can be used to treat insufficient lactation for both deficiency of chi and blood and from chi stagnation. When used for the breast, REN17 is inserted towards the affected breast. When used for chi, it is inserted horizontally downwards. REN17, the summary of function, tonifies qi and strengthen the gathering qi, the song qi, for weak voice, tiredness, propensity to catching colds, spontaneous sweating. It also opens the chest, regulates qi, and promotes descending of qi. Chest pain, for wheezing, breathlessness, cough, fullness, and oppression of the chest. It also benefits the breast and promotes lactation, that is for insufficient lactation, breast abscess, breast distension. The REN17 is also known as the upper C of qi and another name for the pericardium. These alternative names reflect the status of REN17 as both the meeting point of qi and the front move point of the pericardium. The term mu means to gather or to collect, and the front move points are whether the qi of the Zang-Fu gathers and concentrates on the anterior surface of the body. According to the spiritual Faibot, REN17 is the C of qi, linking with Do14, Do15, stomach 9. So this passage states, when the C of qi is in excess, there is fullness in the chest, urgent breathing, and a red complexion. When the C of qi is deficient, there is scanty energy, insufficient for speech. These indications reflect the ability of the REN17 to regulate qi in the chest as well as to treat breathlessness with inability to speak. The spiritual pivot says that the gathering qi accumulates in the upper C, which is lower pathway flowing down to stomach 30 and its upper pathway entering the respiratory passage. Located in the center of the chest, REN17 has strong effect on the gathering qi, which in turn oversees both the lung function of dominating qi and controlling respiration and speech, and the heart function of governing the blood and blood vessels. According to the illustrated supplement to the classic of categories, REN17 can treat all types of abrasing qi and dyspnea. When the lung fails to descend qi and controls respiration, whether due to attack by external pathogens or to interior disharmony, there will be various manifestations of accumulation or rebellion of qi, such as cough, dyspnea, wheezing, asthma, and fullness and oppression of the chest. REN17 is an important local point to relieve such accumulation of qi in the chest and to descend rebellion of lung qi. When the gathering qi is deficient, then both the lung and heart qi will be deficient. In the lungs, there will be shortness of breath, while if the heart qi fails to move the blood and the blood vessel in the chest, there will be chest painful obstruction and pain in the heart and chest with fullness and oppression. REN17 is one of the primary points to regulate the gathering qi. The action of REN17 on descending rebellion of qi extends to the middle jaw, and it is able to restore harmony to the stomach in cases of difficult ingestion, acid regurgitation, esophageal constriction, and vomiting. Located midway between the breast, REN17 is a principal point in the treatment of insufficient lactation. According to the observation of women by Zang-Jing Yu, qi and blood in the conception and penetrating vessels in women transforms into menstrual blood when it descends and into milk when it ascends. Delayed or insufficient production of milk after delivery is due to deficiency of qi and blood. While the book of Literati, Care of Parents, states sobbing, crying, grief, anger, or depression lead to obstruction of the milk passage. These two quotations illustrates the two main patterns underlying insufficient lactation, namely deficiency of qi and blood and chi stagnation. In either case, REN17 may be used in combination with other suitable points and is frequently found in combination with small intestine 1 in classical combinations. Similarly, REN17 is often used clinically in the treatment of distension and pain of the breast and breast abscess. Where any of this breast disorder is unilateral, the needle of REN17 may be directed towards the affected side to induce chi sensation into the breast, while if the disorder is bilateral, the needle may be directed first to one side and then to the other. Thank you for your attention.